In our studios today is Dr. Gregory Mauck from the Kaskaskia Valley Animal Hospital in Sullivan. He'll be talking to us about Parvo, a leading killer of puppies. But Parvo is totally preventable, right guys? Find out more next on the Paw Report. Welcome to the Paw Report. I'm your host, Kate Pleasant. I'm here today with Dr. Gregory Mauck from the Kaskaskia Valley Animal Hospital in Sullivan. Thanks for joining me today.
Well, I'm glad to be here.
And we are talking about Parvo. And for maybe those of us that aren't familiar with Parvo, could you explain what it is and what type of animal it affects?
Yes, well, parvovirus is very common. And unfortunately, it's one of those diseases that we see that we really shouldn't see because it's completely preventable.
Okay.
And so parvovirus is a virus that mainly is seen attacking the intestine of the dog. That's the symptoms that it produces. The virus likes to attack cells that are dividing rapidly. So the two big cells that it attacks are the lining cells of the intestines and the white blood cells, because those are the two cells in the body that tend to divide the most rapidly. So that's where we see our symptoms. So it kind of has a sneaky attack on the body.
Okay.
It attacks that lining cell, but by destroying the white blood cells, it limits the immune response. So it limits the dog's ability to fight it off.
Okay.
So what it does in the intestine, along your intestinal wall, you have little fingery things called villi. And the parvo attacks the villi right at the base here. And so it basically just mows those things off. So it'd be just like if I cut my fingers off, I'd have some bloody stumps there. So basically all along your intestinal wall, you have microscopic little bloody, bleeding stumps.
Okay.
So that's very irritating.
Sure.
So the symptoms we see with it, and it's a very rapid virus. Dogs get exposed to it. They develop symptoms within a few days, 3 to 7 days usually.
Okay.
And sometimes they are totally normal. 36 hours later, they're dead. That's how rapidly
very
they can
quick.
kill. And we see different strains of it. Some of them are a little less aggressive than others. But basically the dog gets exposed, it attacks the lining, and so they start feeling lousy. So the first signs we see is a puppy, and these is mainly puppies, and I'll talk about that in a second. But they start acting a little blah, and so people will notice, well, they're not quite acting up to snuff. But then they say, well, hey, he's not eating. You know, and a normal puppy eats quite a bit.
Sure.
And then the vomiting starts, and then the diarrhea with blood in it usually.
Okay.
So those are kind of the stages we see of it. And so these puppies show up at the office, usually the middle stages, they're not eating or they're vomiting, and sometimes in the later stages where they've got these horrible bloody diarrheas. And, you know, we kind of go from there with it. But, you know, I mentioned puppies, and it will attack older dogs. Doesn't usually kill an adult dog. But puppies with their poor immune systems, it will hit them and just wipe them out rapidly.
Okay. So it's quick moving, obviously, like you said, 36 hours, you could have a dead puppy on your hands. And so you primarily see it in just the puppies though, right?
That's ones where we see the big symptoms.
Okay.
And the reason for that is, and the reason we shouldn't see it, is puppies have no defense against it unless they've been vaccinated properly.
Okay.
And if you look at all the dogs we see with it, none of them are vaccinated properly. If a puppy gets his proper vaccines on time when he's supposed to have them and he's given the proper vaccines, the chance of them getting it is almost zero. They're just basically not going to get it. So every dog we see with it, every puppy we see with it, they're not vaccinated properly. If it's an adult dog, it's a dog that's either never been vaccinated or their vaccines have lapsed.
Okay.
Maybe they were vaccinated early on, but then they weren't vaccinated anymore. 2-3 years goes by, their immune system drops and they become infected. Puppies real typically come in and most of them have had no vaccines or they've had one vaccine. And people, you know, will get a new puppy and the breeder says, hey, I've vaccinated it. Well, that's just the start.
Right.
You know, they're going to need a series of vaccines to build their immunity. And so a lot of times they get that first vaccine, and then they're done, and then they don't follow up.
Okay.
And finish that to get the full immunity.
Right.
So that's very, very typical.
Okay. And so where does the exposure to parvo come from? Is it an airborne thing? Is it something they pick up somewhere?
Yeah, well, that's an excellent question. And this is why parvo is so uniquely nasty. Because you don't have to be, or a puppy doesn't have to be around another dog to get it.
Okay.
Because they don't get it usually directly from another dog. Parvo, with this way it's attacking the intestine, is passed out in the stool in that diarrhea. Literally billions and billions and billions of them. So they're passed out onto the ground, and the dog starts shedding them before it's ever sick.
Oh, okay.
So you can have a totally, dog that looks perfectly healthy,
right?
And you're walking around, he's going to the bathroom passing parvo out. Now he's going to get sick in a day or two, but for a couple of days he's shedding the virus, nobody knows it. But the dogs that are sick shed the virus. It lays on the ground for weeks, months, possibly even years. It's a very hardy virus. Parvoviruses are very small, and they're very hardy viruses. And so they can lay on a surface. Like I could put some parvo on this table here, and it would literally, if you didn't clean it, it would lay there till next year.
And most of
be
us don't
infected.
clean our yards. So.
Yeah, yeah. So most dogs get it off the ground, out in the yard. And people come in and say, I got this puppy, and he's got parvo, but he's never left my yard. Where did he get it? He's not been around any other dogs. And, I tell them, well, you have parvo in your yard. At some point in time, a dog has come through, gone to the bathroom in your yard, and left parvo there. And each stool that they pass out would have billions of viruses in it.
Okay.
And so they're just laying there on the ground until the next dog comes along and picks it up. But it's not like, say, distemper, for example, which is a respiratory type thing, usually passed like that. And you'd have to have a dog-to-dog, or with distemper, they can get it from other animals like raccoons. But you have to have that animal-to-animal contact for the most part to pick it up. With parvo, they just get it off the ground.
Okay, so it's something that's already there, usually most of the time. So, okay, so if, you've got that, we've covered exposure, we've covered what parvo is, so let's talk about the vaccinations. How often, what's the process like for the dog, that kind of thing?
Well, the vaccines, like I say, we need a series of them. And the reason we need a series is the dog's born with antibodies from his mother. The mother has antibodies, and we have the puppies in the uterus. And the antibodies come across the placental wall and go into the puppy. So when the puppy's born, he's immune.
Okay.
But as time goes by, those are called maternal antibodies. As time passes, those antibodies slowly peter away.
Okay.
The body, they're used up, they're gone. So the puppy has to develop its own immunity.
Okay.
And so the only way the puppy can develop its own immunity is by getting vaccines. Well, when we give that first vaccine at 7 weeks is when we usually want to do that, 6 to 7. The mother's antibodies are still hanging out. And so we give the vaccine, and it helps the puppy start developing an immunity, but most of his protection at that point is still from his mother.
Okay.
So each time we give a vaccine, we're boosting the puppy's own immunity so that he's developing his own antibodies as his mother drops off.
Okay.
And so that takes that series. And so we do them usually at about 7, 10, 13, and 16 to 17 weeks.
Yeah, I was just remembering I had puppies, and I remember going through that, so I knew it was a series.
Yeah. And if we don't stay on schedule, let's say we do one at 7 weeks, and then somebody gets busy, and they don't show up till 12 weeks. Well, we've got a gap there where the mother's antibodies may drop off, and then, we haven't gotten, and then we see that a lot. The prime time that the puppies become really sensitive to parvo is around 12 weeks.
Okay.
So at that point in time, if they're not being vaccinated properly, their mother's antibodies have dropped to the level that they're not protected.
Okay.
And at that time, the death rate is a lot of times 90%, if say it's a 12-week-old puppy who's not been vaccinated.
Okay.
But we do those at 7, 10, 13, 16 weeks.
Okay.
And then it helps get the puppy's antibodies up. And the one other thing that has to do with vaccine with Parvo that's different than some of the other drugs or other diseases, Parvo antibodies from the mother tend to hang around and interfere with our vaccination longer than other viruses.
Okay.
Like, for example, distemper, usually by that 13-week vaccine, the puppy's got really good immunity to distemper. And so that's probably about as far as we need to go. With Parvo, some puppies, their mother's antibodies hang around for up to 16 to 17 weeks and interfere with our vaccines we're giving.
Oh, okay.
So I've seen a number of dogs over the year who come in with Parvo 4 or 5 months, and they've had 7, 10, 13 weeks. They just got busy and didn't get that 16 to 17 week
Okay.
one. And they just happened to be one of the dogs that had mother antibodies there for that extended period of time and kind of knocked our vaccines out. The puppy didn't get good response, and now the mother's antibodies are gone and the puppy gets infected.
Okay.
So
So this is a completely preventable disease, though.
Yeah.
People just need to stay on that schedule.
right.
Okay.
And that's the problem. The big thing we see is, and it's, it's sickening to us. We have these puppies come in and they're deathly ill. Lots of them die. And I'll talk about the treatment here in a second. But there's just honestly no reason for it. There's, these puppies, none of them need to be infected with Parvo. So, it's one of those things that if people do what they're supposed to do, then they won't have the disease. And treating Parvo, the cost of treating it, they can vaccinate their dog for their entire life for what it costs to treat it one time.
So it can be relatively expensive.
Yeah,
Okay.
yes, it can
So
be
is
very
there,
expensive.
Is there a test that you run when they come into the office? Talk about that and then kind of the treatment process.
So we have this puppy come in, and he's sick. He feels lousy, and he's throwing up. Maybe has some diarrhea. Well, that can be numerous things. It can be Parvo. It can be a bacterial infection in his gut. It could be hookworms, whipworms. It can be numerous things.
Sure.
So we want to know, is this Parvo? Because if it is, we have to be very aggressive with it. Because if we don't get in front of the disease, if we wait till it gets bad, then try to treat it, that's usually a losing proposition. So we need to know right up front, does this puppy have Parvo? And if it does, we need to be aggressive. So the stool contains all those viruses. So how we test for it, a lot of tests are blood tests.
Right.
Well, this is not one of those. What we're testing for is the actual proteins of the virus in the stool.
Okay.
So we take a little bit of stool, and it just takes a tiny bit because there's billions and billions and billions if they're there. So we take a little bit of stool, and we do an immune type of test. It's called an ELISA test.
Okay.
And it's quite simple, actually. We take the little bit of stool, mix it with some reagent, and pour it into a little test kit. And on the test kit, there's a little membrane that has some reactive bars.
Okay.
And just to make it simple, and as the mixture of stool and the reagent goes across that membrane, then it reacts with those bars.
Okay.
Well, one bar always reacts and turns dark, and that tells us our test is working. The other bar only reacts if there's parvovirus antigen proteins there. And so the test is extremely specific and it's extremely sensitive. In other words, we'll pick up tiny little bits of virus, and if it's positive, we can rest assured that dog has Parvo.
Okay.
So we have a really, really good test for it, and it takes just 5 minutes.
Well, that's good.
So it's one of those things where, if we have a suspicion that this puppy has Parvo, in 5 minutes we can say yes or no. Does it have it? If it does, then we need to get moving.
Okay, and then you would begin the treatment process. And
Right.
what is involved in treating Parvo?
Well, there's kind of two ways to go with it, one is some people opt because of cost, because it can be very expensive. They opt to do home treatment, and with that, we're doing antibiotics, we're doing gut coating protectants and try to get fluids into them. Because Parvo is like most viruses, there's no drug that we can give that's going to kill the Parvo. It's not like if you have a bacterial infection, we can give you an antibiotic and it'll kill the bacteria. Well, it's not like that with most viruses. Most viruses, if you get it, you got it, and you got to deal with it.
Right.
And Parvo's like that. So we don't have any drug we can give you to kill the Parvo. It's got to run its course. And it's going to run its course no matter what we do.
Right.
Even with our treatment, the virus is still going to do whatever it wants to do. It couldn't care less what we're doing. So it's going to multiply, divide, until the body's immune system kills it off.
Okay.
Okay, so what we have to do is support that dog during that time so that he can live through that period till his immune system has time to kill the virus.
Okay.
So like, for example, we couldn't give a vaccine at that point in time and kill the virus. It wouldn't have time for the body to develop those antibodies that are going to kill it.
Right, okay.
So we have to just rely on the other parts of the immune system to do that. So our supportive treatment, we were talking about those villi that get mowed off.
Right.
So a couple things are happening with that. And if you would look at an intestine from a puppy that had Parvo, you would think somebody took steel wool to it. I mean, it is that raw. It's horrible looking. So since we have this wall that is basically completely denuded of the surface layer, there's two things that are going on. Things are escaping from the body that shouldn't get out, and bad things that shouldn't get in are getting in.
Okay.
So the things that are getting out, number one is fluid. So these guys dehydrate rapidly because the membrane of the intestine is like a little wall there. It keeps the good things in, the bad things out.
Okay.
So now that it's not there, the fluids, electrolytes, proteins from the body, all this stuff just pouring out into the gut,
Okay.
which is what's causing all the diarrhea.
Right.
So all that's coming out. Blood, just frank blood. So all that good stuff's going out. The bad stuff that's getting in is worse, actually. We can we can replace most of that fluid.
Right, the good
We can
stuff.
do IV fluids. We can do a lot. Electrolytes, all that. The bad thing is all the bad stuff that's coming in.
Okay.
So most people don't realize it, but if you take your intestines, there's a lot of really, really bad things in there. And they don't normally get into your body because of the
wall.
membrane. So two of the bad things, there's lots of nasty, nasty bacteria. You always hear about E. coli, there's Clostridium, there's Salmonella, there's all those bad guys hanging out in your gut. And now they can come right across the wall and invade your body.
Okay.
The vast majority of puppies that get Parvo do get whole body infections from E. coli, things like that. So they end up with pneumonia, things along those lines.
Okay.
So we're giving potent antibiotics to cover the full spectrum of bacteria that are coming up out of the gut. So that's number one thing to try to stop that. The other really bad thing that's getting into the body, and this is one of the things that ends up killing the dog most of the time, in the cell wall of bacteria, there's a complex protein, or sugar. It's called a polysaccharide.
Okay.
And so it's called endotoxin. And you don't hear about endotoxin much, but it is extremely toxic. It's one of the most toxic natural substances on Earth. And we walk around with it. Everybody does. Horses, cows, dogs, whatever, with it in your intestines all the time. And what it is when bacteria live and die, when they die, their cell wall breaks down and releases this polysaccharide, this endotoxin.
Okay.
And when the wall of the intestine's intact, it just gets passed out in the stool for the most part. And so it doesn't bother you. Little bits are absorbed, but your body can handle that. It's detoxified mainly in the liver.
Okay.
So if you have steel wool taken to your intestinal tract, then huge amounts of endotoxin escape into your system. Or when those E. coli's and salmonellas and all those guys get into your system, into your bloodstream, they're dying in there too and releasing endotoxin.
Okay.
So that's the big killer with Parvo is toxic shock.
Okay.
And so endotoxin in the body causes shock, which is a your blood pressure just plummets.
Okay.
Your blood vessels open up, and all the fluid, we're losing fluid out of the body. Well, now we've got these dilated blood vessels, and we don't have enough blood to fill them. And so that's what shock is.
Okay.
And so out in the periphery of your body, since we don't have now good blood supply, we look at the gums of these puppies. Instead of bright and pink, they're purple or pale because there's no blood flowing through them. And so lots of bad things metabolically start happening out in the periphery of your body because you don't have proper blood supply. And lots of toxins build up, and that's what ends up killing most puppies with parvovirus is endotoxemia.
Okay. So really though, once do the treatments, are they successful once you get the treatments going?
And and a lot of diseases are like this. We, say we have an animal come in with kidney disease, and we look at them and we say, oh, you don't look too bad. And sometimes they're a lot worse than they look. And sometimes they look terrible and they do fine. And parvo is no different than that. So we'll have a puppy that looks terrible and responds really well. And we have other puppies that, well, they don't look too bad and they don't make it. And so we give everybody a guarded prognosis. We've had 3 puppies in the last 2 weeks with parvo.
Wow.
And one of them looked pretty bad when he showed up, and the other 2 looked really good. Matter of fact, both of those 2 we didn't even think had parvo till we tested them and found out they did. Well, the first one that didn't look very good, he already had icky, bloody diarrhea. That dog didn't last 6 hours. The other 2, the first one that looked pretty good, and all 3 of these dogs, the owners opted to be very aggressive with their treatment. So it's not like these puppies died because they weren't treated properly, because sometimes owners don't do that, and the death rate, if we don't treat them aggressively, 80-90% and above. If we treat aggressively, we usually can tell people, we've got a 60, 70, 80% chance of things going well. So the second puppy, who looked pretty good, died in about 36 hours. He looked good and just took a tailspin.
Downhill that fast.
Yeah.
Okay.
The third puppy, who again looked real good, did great. He never hardly even got sick. He was vomiting and, had some diarrhea, but never had the blood, did well. And so sometimes it's just really hard for us to say up front how well they're going to do.
Sure.
And we always give people, like I say, a guarded prognosis. Things look good, but it may not go as well as things look. And I've had puppies that really I didn't think they were going to last the day, who did fine and
went home
did real well. So that aggressive treatment is fluids, IV fluids, IV antibiotics, gut protectants, coating type agents, if we can do that, if they can hold that down. Drugs, IV drugs that suppress vomiting, because we don't want to be losing fluid this way, because it's all definitely going the other way. And there's also a drug that specifically inhibits endotoxin. And it's actually a large animal drug, but we can use it off-label in dogs, and it can make a huge difference in puppies. And so we'll use that drug also. And so that's basically our basic treatment for those guys.
All right. Well, Dr. Gregory Mauck, we're about out of time today. We appreciate you coming down from Sullivan, and hopefully we'll see you again sometime.
Okay. Well, thanks a lot.
Thank you. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show or animals to be featured on our Adoptable Pets segment, please contact us by emailing kfpleasant@eiu.edu or call 581-6960. Or if you have a topic you'd like to see on the show or questions for our experts, contact us with those too.